Rosalyn George, board-certified dermatologist and owner of Wilmington Dermatology Center in Wilmington, North Carolina. Today we're going to be discussing the Fraxel Dual. It's like my baby device. It's one of my favorite things, really one of the workhorses in our practice. And the science behind Fraxel is earlier on in the 80s, there used to be ablative lasers, and so people would go and go into the hospital and their face would be treated fully with a laser. And what would happen is there was a lot of downtime, a lot of healing, and then there was the potential of pigment change and also scarring. And so what was developed was fractionated lasers. And what that means is we're really using little tiny microthermal zones. So little areas of little tiny holes of laser gone into the skin, and what that does is it leaves normal skin around it so that the healing time is a lot faster. So you can get those transformative results. It may take a few more treatments, and the good thing is that you have a lot less downtime. So instead of having months of redness and a few weeks of having to do dressings and antibiotics and soaks, and then at the end of it maybe having some different color, like your face was white and your neck was brown, we don't see that with the Fraxel. And so this one is the dual. It has two wavelengths, and what that means, it has two wavelengths. So you have the 1550 wavelength, and what that does, it goes a little bit deeper. And it works on acne scars, deeper wrinkles, a little bit of tightening, but really not a ton of tightening. Pore size works very well on. And then you have the 1927, which is a little bit more superficial, and that's great for precancerous lesions as well as brown spots. So we do all this stuff to look better, and the number one thing that ages somebody is how their skin looks. So if your skin doesn't look healthy, you can spend all the money on Botox, you can spend all the money on fillers, but you really are not going to get that full facial rejuvenation until you address the skin quality. And that's really what Fraxel does. So the process with Fraxel is you come in, we put a numbing cream on your face for about an hour. That numbs the skin. It is uncomfortable. Some people will prefer to take a little anti-anxiety medicine beforehand, and that just makes the procedure a little bit easier for you. It takes about 10-15 minutes to do a full face. You can also treat the hands. The chest is also a very popular place. The neck is also a popular place to treat, especially with the photo damage that we see down here at the beach. It takes about 15-20 minutes. You will be red like you have a sunburn, swollen like you have a little bit of an allergic reaction to something, and usually within 2 to 3 days that is much reduced. So on day 4 most people can go back to their normal lives. Because we're only treating a fraction of the skin at the same time, it usually takes 3 or 4 to get the best results. And if you have more of something that, say, deeper acne scars or deeper wrinkles, it might take up to 6 treatments to get the desired results. But one of those things that almost everybody is happy with, works consistently. Because it's a laser, we don't want to use it in the summertime. Lasers in sun are bad, so if you have tan skin or have been out in the sun, don't have a laser procedure. Living at the beach, I have people that come in, and even in maybe April, and they've already been out in the sun, and we say, you know what, it's just better that we treat you when you haven't had sun exposure, when you're not going to be out in the sun, because when you're having a procedure done to transform your skin, you don't want to put yourself at undue risk of having anything go wrong. So make sure you go to somebody who knows what they're doing, understands lasers, what the side effects are, and how to manage potential complications, because we do see complications if people are treated inappropriately. So consider Fraxel if you have a lot of wrinkles, acne scars, or a lot of sun damage.